my name is Jo Everell-Taylor from Better Body Training, and I just wanted to talk to you today about some modifications that you can make to help your clients who are struggling with things like hip bursitis or glute med tendinopathy, or just complaining of irritation around those hip areas. And it can be really quite common in middle-aged, menopausal, postmenopausal women who those changes in estrogen can affect their soft tissue makeup. It can affect how they respond to inflammation, etc. So you might already have a whole cohort of people in your sessions that you're thinking, yeah, actually, what do we do? And it's just looking at how we can offset putting any extra pressure in those areas. So some of the first ones, thinking about the work that you do. Now I'm showing you mat work, and I appreciate some of you work on reformers, so thinking legs in straps, etc. But just mimicking that, we do our mat work with our bands. So if we're thinking about our clients doing leg circles here, so they might be fine when they come out to the side, but as they cross over the midline, you start to get an increase of compressive force going through the tendon, coming through onto the bursa sac here. So that can start to irritate it even more, make it worse. And certainly if you're a person and you're adding in your classes that cross hip stretch, yeah, lovely, unless you're irritated here. So we're wanting to think about not putting that load into this area, not compressing it in anymore. So that might mean that we need to come back all the way back to something like a tabletop position, a bent leg, because it takes the load out, and we just work in a small range of motion. So like it is with most of these things, isn't it? It's about where the load is and what that range of motion is. They can still lots of valuable work on that pelvic stability, on that rib cage connection, etc., length through neck, all of your normal setup cues, but thinking about how we control that tendon compression here. It can be a similar thing in knee openers, similar or related as well, because of how we've got the glutes activating in a knee opener here. So if you're doing this type of work here, you might want to consider changing it to a straight leg version here. You can play around with the flex and the point of the foot to give some options. And again, it's about range, isn't it? And it's about that control and that precision of movement. Thinking about that lower leg and how we're loading into that now, well, of course, you can use your cushions. So popping cushions, so these nice thin padded cushions are my favourites, but it could be a folded towel. So popping something like that under can make it so much more comfortable. Other things that we can do to improve that comfort, keeping that lower leg bent, so it adds a greater range or an amount of a stable base rather than being in a straight leg position here. So keeping that leg bent here can potentially make it more comfortable to do a whole range of things here that they might be doing, or you might be programming in your Pilates sessions. I would avoid anything where we're lengthening out and doing a double hip float, for example, or double leg float rather, because of that pressure that you're putting into that lower leg. So all of our programming should be about how we release or reduce that pressure. You could try coming into a bit of a banana shape and encouraging them to come out of what we think of as our optimal alignment, because it's optimal for them is different at this point, and letting them rock back so they're actually leaning a bit more onto their glutes, so that you can do things, if you're doing things like a small range of springy legs, all those different exercises that you might be doing here. So keeping that connection, but again, you could also bend the lower leg for that as well. A ball or a cushion, a bigger cushion, is really good if people are lying on their sides, to help them keep this hip in alignment so they're not getting that tendon compression through here. So just having that there, and again, that's another nice thing that they could do potentially if they're sleeping at night, is pop something between the knees. And there are cushions that you can buy especially for that, and that will make a difference to sort of their ongoing daily irritation in that area. For us, thinking about squats and things that you might have in, say, your preparation phase, or if you're doing a sort of a higher intensity Pilates preparation phase. You might have things like a plie squat, you might have things like a curtsy squat, and again both of those can cause trouble and irritation for those clients that we're talking about. So thinking about, as we go over here, we're pressing away into here, and this area is unlengthened, we've got compression into the hip. And in our plie squat, again we've got a similar thing. We've got glute min working hard, drawing back, and their tendon connections can cause that issue as well. So it might be you just default back. I know it's not very exciting, to your normal parallel squats. So you're doing your monkey squats, etc. Remember, the ball is their friend to help them with alignment because they're likely to be less stable around that area. We know that when we're in pain, we have less stability because we start to switch off neurally in different ways. We don't know what's going on, so we can help with props for that. The final one I wanted to talk about was single leg balance work. Now, I don't know about you, but I always put some balance work in, balance challenges in my sessions. It's so important, isn't it? But we need to be mindful if they are inflamed in these areas. As soon as, so if we just something simple like a single leg float, what's going on here? Well, we've added load into the area because it's all on that single leg. So how are they controlling that load? What's their technique like, and are they hitching to the side? And again, they're going to get compression and irritation. So it might be you encourage them to have their hand there so that they're not doing that, but also that actually they don't lift fully. Maybe they keep the leg or the foot here on the mat rather than lifting up here. But if they are at that point where they're maybe coming out of this phase of irritation and inflammation, that they're able to do that but not do this hitching. Keep this connected. Yeah? So you might have to be smart with it. Take the load out, let them hold onto a chair or a wall. These are not problems in terms of your programming. You can do all of this. You just need to be maybe planned beforehand. And also just maybe having a chat with them that this is their normal for the moment. They can get through this, and if they look after that area, hopefully that their recovery will be quicker as well. We certainly don't want to be doing anything in our sessions that is making that situation worse. So hopefully that's giving you some food for thought and some ideas that you can go away and try. I'm sure you've got clients that you're thinking, oh yeah, I know that they need a little bit of help with that. I hope it helps, and I will see you soon. Take care, bye.